So I know a lot of people might recognize the name PACT or Parents and Children Together, but I found out a lot about that there's so much more than what I think people assume or realize that goes on at PACT. So I thought it'd be interesting to hear what type of things PACT does, what part of the community PACT serves, and get to know a little more about what Parents and Children Together is all about.
Yeah, sure. Parents and Children Together, we're also known as PACT, we're a community-based organization. We started a little bit over 50 years ago in 1968, and we were actually formed by the residents of Kuhio Park Terrace. So we started in Kuhio Park Terrace here in Kalihi, and it was the residents that recognized that when this housing complex opened, they needed some services, and so they started PACT. And from there, over the years, we've sort of grown and evolved and brought on more services than what was originally started here in Kalihi. And so we've moved to be a statewide agency. We do work now in sort of like 7 broad areas. We do a lot of work in early childhood learning, a lot of work around domestic violence, child abuse, behavioral health, poverty prevention, workforce development, and we do some teen programs for after school youth. And so we've done that over the years, and we sort of found opportunities in different communities across the state to, fill gaps where services were needed. And it's a sort of a mouthful. We do a lot, and it keeps us very busy. But one of the benefits of this is we were able to leverage. We're kind of like a lot of small nonprofits put together under one umbrella,
Mm.
and that's sort of how we look at it sometimes. But what that does is it allows us to leverage our our reach, our size, to really be as efficient as possible and to serve as many people as possible. So we can cross support families. So someone might be coming to us for early learning. A family might be coming for early childcare or early learning programs, but they might be dealing with domestic violence, or they may be dealing with behavioral health issues, and then we can leverage that or point them in the right direction as well. And our size allows us that flexibility to really support the programs as best as possible.
So I know you've been there for a little while now. In what you've seen, because you get to see firsthand what the organization and the different programs have been able to do in the community. What are some of the things that you've gotten to see that have been a result of the programs and the people that make up PACT? And what has it done in the community that maybe that really stands out to you, that when you're long gone, you'll feel like, this was a really cool thing that was able to be accomplished because of this program?
That's always a good question. You start to naturally think about what are those big projects that you've accomplished, or what is the big initiative that you created for the community, and we have those that we've done over the time, at least the time that I've been there. But what always sort of grounds me are one thing that I learned about being here at PACT is the value set that I walked into. So I was very fortunate to walk into this value set here, and it was really focused around that individualized relationship that we build with our families or our keiki or whoever is sitting in front of us. We have always merged away from like sort of cookie cutter type approaches and really
Huh.
focused on how do we best meet the needs of that individual sitting in front of us. So sometimes our numbers, when we see numbers, a lot of nonprofits get judged on how many people they serve. So that's a
Hmm.
question that gets, you see on people's websites, like we serve this many people a year, and
Right.
almost the higher number, the better. One of the things here at PACT has always been about, doesn't matter how many people we have, it's about that one person that sits in front of you. And if we can make a difference in that person's life, we're going to do our absolute best to do so. It's fortunate that we also have size as well to be able to reach a lot of folks, but it's always been about making an impact in that person's life in front of us. And so I think what drives me, and when I walk away from this place at some point in my life, always, the things that are going to stick with me are not so much those big initiatives that we created. It's always going to be about those individual stories that we're able to tell because of that relationship we built with that family. the stories of someone saying to us, like, there's instances where we've helped someone find safety from domestic violence, and they basically come back a year later, 2 years later, and say, if it wasn't for the work that you guys have done, I probably wouldn't be here. Or now I can tell my family, because of the support that you and maybe other organizations have come together to help me with, that I can tell my child tonight where we're going to sleep because you helped provide me shelter. I mean, those are the stories that I sort of remember, because for every one of those stories, I remember that face, or I remember that individual that we were able to help. And so that for me has always been a strong reminder of, it's about the people and not the not the institution. It's about how do we help every individual along the way, and that's the part that's going to stick with me moving forward.
What drew you to working or to PACT? Like, was there any kind of a personal connection in your past or your history that drew you to wanting to connect with PACT and be involved with the programs there?
Yeah, so this is a little bit of a long story, but I'll condense it. I actually do have a very personal story that not many people knew about when I got here, because I didn't want that to be a factor in determining whether or not someone selected me for this role or not. But there was a personal connection, and one of the areas that we work in is around domestic violence, and domestic violence touches so many of our families here in Hawaii and across the world. And then unfortunately, it was something that impacted my family. And when this opportunity came up, to serve in this capacity for PACT, our previous CEO here was retiring, and so that position became available. I applied, but there, growing up with domestic violence is a tough thing, and it was, I sort of am cautious about how I say this because it impacts some people in my family, and my mom and dad got divorced early on. It wasn't there was nothing. They're both very loving parents to me, but growing up, there are individuals within my family who are struggling with this, and growing up, you live in you grew up in Hawaii, and you sort of taught, this is not something you talk about. You
Right.
sort of on the rug, move on, none of your business, right?
Mm-hmm.
And I think for me, that was a big thing that was bothering me. And I think back to those times, and I wish I did more to help that family member, because I know the impacts it has on them and other people who are around. But I was young. I didn't know. And that's not an excuse, but I was young. But it wasn't until someone at PACT actually helped my family that way.
Wow.
And so when this opportunity came out, it was almost an opportunity for me to come back full circle and help influence this organization that did so much for me as well. And I sort of left it up to, the people that had the decision to see if this was the right, place and fit for myself. And I was fortunate that it was. And so I feel very much at home, and I feel very much indebted to the work that they did for me personally, in a way that I feel like those are the same things I want for other folks in the community as well.
That's an amazing story, and I'm really appreciative that you shared that with us, because in the different people that I've met that work in nonprofits especially here in Hawaii, there always seems to be some kind of personal connection. There almost has to be, in a way, because it's hard work. It's a lot of times thankless. It's a lot of times more than a lot of people can normally bear. But what drives them is this personal connection, whether it's because of the work being done or because of a past story. And I think for people to hear your story, it also brings a little bit of a connection too for people who might be needing the services or help of PACT, and to know that you understand what they're going through. And I think that really helps a lot of people with knowing each other's stories, and it brings more comfort, and I think it's a beautiful thing that you are willing to share that. So thank you for sharing that with us.
Oh, no problem. Those are all, we all have stories, and I think the thing that makes all of us unique, and The benefit of my story has always been for me is that when I hear someone come to us and I hear their story and I hear what they're going through, it's sort of innate in all of us. I'm not, but you have social workers, and it's sort of innate in social workers or anyone to just want to solve or help solve problems. But again, everyone has their own story, and we just don't know what they went through. They can articulate some of it, but we don't know everyone's, you know, history and every single step along the way that they've been challenged or had to persevere or overcome to get to wherever they are now. And that uniqueness really makes their story unique. And the benefit of having just to think about my story and hearing other stories, that we really got to take it. We just can't say that we know how to solve these problems. We got to walk side by side with folks and do our best to encourage and provide that sense of resilience around whatever issue that they're going with. Because, like I said, there is no cookie cutter out there.
Yeah.
The best thing we can do is listen and guide.
You mentioned resilience there, and that kind of brings me to my next topic here. Everybody's being hit by the quarantines and the coronavirus outbreak and the pandemic, and in so many different ways. But I think what's been tough for a lot of the nonprofit sectors, it seems to hit the nonprofit sector extremely hard. How has this pandemic affected what's going on with PACT, and what have you guys been able to do to kind of shift and adjust and make it through this hard time?
I mean, we are a business, right? And like many businesses, we've been challenged, like you just mentioned, because of the situation that we're in now. And so many of us have had challenges in terms of finding and being able to be sustainable during this time, having enough funding to do our work. And I think, like you mentioned now, like our work hasn't decreased, right? Our work is also increased. And when you think about our sector is designed to respond to the most critical needs in the community, like COVID-19. I mean, this is sort of what we've been built for, is to respond to crises and chaos and provide solutions. And that's what we've been doing all these years. And our work, in order to do that work from a business standpoint, many of us get contracts to do that work from maybe government or private funders or donations, right? And we also are able to leverage tax benefits. Well, during this time, some of that structure has gone away, like many businesses. Like we lost a lot of private donations because many people are struggling now and can't give, right? We have government who also need to figure out how they're going to make their budgets. And so, where do they decide to cut back on? And that's impacted us too. So we're all sort of challenged with this sense of, can we have less of a pot of money to do this work, yet the needs are going up. And so, I think it's a tough decision for all of us. I mean, I think some nonprofits have decided to scale back on services, even though the need is higher. Some have decided to just figure out how they're going to stay in business as long as possible with whatever resources they have, cash. We've been sort of fortunate. I mean, we have had cuts, but we've been able to maintain and shift in ways that still provide services for the community. Like Melanie and my colleagues out there, they've shifted a lot of their work from more the one-on-one in-person to more what we call teleservicing or telehealth. And that's good and bad. It's good that we're still having that connection with clients. So you sort of miss the intimacy of the one-on-one piece, because there's times that we go into people's homes and we do home visits, and through that we're able to assess their home environment and look to see what all the needs are. We don't really have that. It's a little hard to. I can see in the back there what your home looks like, but it doesn't give me a sense of what else you're dealing with too, right? It just gives me that snapshot. So we're doing our best in terms of that, and working with with Zoom and all the other technology that we have to still connect. There might be some benefit, like because we're doing this teleservicing, we technically are able to spend maybe a little bit more time with it, because there's less time on the road traveling, so we can spend maybe a little bit more time than we would with them. Obviously, there's issues with technology. Not all of our families are able to get technology, so that sort of. But I would say that with those challenges, with the challenges in funding, We've just sort of shifted operations in ways that we can still meet with clients. But we've also seen a shift too, though, is, with what we're looking at right now, the areas that we focus on are, really sort of, we do some prevention, but we also do a lot of intervention. Like I mentioned things earlier, like domestic violence, child
Hmm.
abuse, early learning, and some poverty work, right? And, what we're seeing now is a really high need for basic needs. And so we focused a lot of our work to really try to provide as many basic needs as possible to our families, because we know right now what's happening is the stress levels are increasing, right? I mean,
Right.
the stress, and those are caused by things like, food insecurity, lack of employment, um,
Hmm.
housing issues, and safety. And so we think about, okay, so if all those things are challenging our families now, and stress goes up, what's the byproduct of all that? The byproduct of all
Hmm.
that will be things like violence. It would be things like increased poverty. It'd be things like mental health issues.
Yeah.
But we want to try to solve those really basic needs as best as possible, or be a part of that solution. And so we've seen that need go up. And, I think that's where a lot of us, and the PACT has shifted towards, is really focusing on those basic needs, because we know if we can do that, it will help relieve the stress on our families and on the system as well.
So when you're saying you're helping with basic needs, the things that you described, so are you collecting and distributing like food and supplies and such like that?
Yeah, so the food piece is a big part of it. We've been providing food to our families. We started, when this all started, it was right around the spring break time, right? So
Yeah.
we often do a, a, a school break, whether it be summer or spring break food program for the kiddos, because a lot of the kids get their meals, at least breakfast and lunch, through the DOE when they're in school. So during the intersessions or when they're on breaks, they're unable to get that because schools are closed.
Right.
We already had planned that we would be doing it during spring break, but we just extended that through the through current times. And we were just fortunate because there's a lot of partners that helped us provide that food.
Oh, good.
Also provide some canned goods and other non-perishables for families during this time as well. I mean, the other thing we're seeing too is helping families navigate through the unemployment system, and trying to get them, the benefits that they can get through that, for those who have been laid off or furloughed to their,
Right.
and a lot of
That's really a great
rental,
resource.
and a lot of rental assistance and utility assistance as well. So
Now, when
yeah,
you say assistance, is it that you're providing financial assistance for them,
yeah,
or oh,
yeah. So through Aloha United Way has raised a significant amount of funds, as well as Hawaii Community Foundation, to support some, some of coverage for rental assistance and utility assistance for families who have been impacted by COVID-19. So
yeah?
helping facilitate the distribution of those funds.
Oh, that's huge, because I think not only not having the funds, but even understanding what to do to navigate through it as well. Because it seems every day we're getting a different update about this is going to happen, or this is what you need to do, and for someone, I think that would give me stress as well, and it has. But for you to be able to be there for them, to help take one less thing off of them, is a huge game changer for them, for sure.
Yeah, and what we're obviously trying to worry about the now, and cover these basic needs, but start looking at the future. You know, there's a report, the Alice report, that told us that half of Hawaii's families were sort of living that paycheck to paycheck, and sort of one disaster away from um, you know being homeless, or having,
Hmm.
not being able to make ends meet. And we're at that disaster, and that paycheck is gone, right?
Yeah.
And so now you have a lot of folks that, even more folks that are below that line, or more folks that are now even beyond that paycheck to paycheck, and struggling. So that's going to be hard. We have to figure out how to get those folks back above, and then continue to help the families that we've always been helping, and that's going to put a lot of stress and strain on our system. I would say I really am sort of concerned about some of the mental health needs, because that stress plays a big role in that.
Hmm.
Even for some of the stuff we're doing right now, in our food programs, we see folks in our lines that we haven't seen before. That those numbers are,
Oh,
are
wow.
folks who have may not have had to reach out for help before, and that's hard on them. But it's also hard on the people who have always been sort of struggling because
Hmm.
now they see more people competing for the same
Yeah.
resources that they needed to go. So we're going to see some tough times ahead, but I think we can do this together if we sort of organize ourselves in a way that really meets those basic needs.
Well, I'm positive that there's going to be a lot of people that hear this and are learning about what you're doing to help our communities, and it resonates with them and they want to support. So, what are ways that they can support, like financially? Like, how can they help financially or voluntarily, or any kind of specific needs that you guys might have that the community can bond together and help with?
I might throw a twist at this request out there. I mean, obviously, there's always a financial need to do this work and
Right.
by the work that many nonprofits are doing, or to provide volunteer time and effort. Those needs always exist. But one of the things I would say that we are, really keeping an eye on right now is this whole stay-at-home order and the impacts of that. One of the I talked about how stress increases during this time, but
Hmm.
one of the things that the stay-at-home order has also that we're keeping an eye on has also done is it while we're trying to flatten the curve from COVID-19, it also has put on hold certain things that we have had in our community that were what we call safety nets for our families. Um, so, I mean, and one of them, for example, are how we care for our keiki. Uh,
Hmm.
as an example, so families are at home, and now they're not going to school. One of the safety nets that were always out there were that when we think about child welfare or child abuse in particular, most a big reporter of those types of issues was the DOE, were teachers, or schools, also
Right.
healthcare providers. When a child goes to a doctor and sees a healthcare provider, they see, they those individuals will likely report any issues that they see to child welfare, and then that family or that child can get the support they need or the safety they need. Right now, people aren't going to school, and now
Hmm.
people and our kids aren't going seeing a doctor unless it's an emergent need. And so that social isolation presents a problem, I think, for us. And we've seen a dip in reporting there of.
Oh, wow.
Uh, and so I think one thing now that we can all do is, in terms of being good neighbors, is to really sort of keep an eye and reach out to our families, understanding too that stress levels have increased. I mean,
Hmm.
if you flip the conversation back, if someone asked me, okay, what would the perfect scenario look like for domestic violence to grow, or for child abuse to grow? I mean,
Hmm.
it's sort of a kind of a like a obscure way of looking at it, but
Right.
what would that environment look like? And I would say something to the effect of increase the stress level on families by taking away employment, you know, in, you know, taking away financial resources, um, um, you know, taking away, other safety nets, put them all in the same house and not let them leave. And so we created that in some sense.
Yeah.
Um, all the resources that were available to families and kiddos before this are many of them are not there in that way. And so how can we as a community play a role in that? And I would say, that those are the kind of things we should be more mindful in thinking about our neighbors. We got the social distancing going on, but if you see something, you gotta say something, and see how we can help that. If it wasn't clear before this, we are so tied to one another that before it was like how healthy I am was how well I took care of myself, right? If I
Hmm.
exercise, if I ate well. Right now, it's so clear that my health is dependent upon your health, and if you're
Mm.
not healthy, then I'm not healthy, right? And I think that just sort of gives us a sense of even more so we're in this together and we're connected, and that if we as a community aren't caring for one another, then I think you'll see what happened, like what we see now is that shutdown until we
Yeah.
take care of everyone, right? So I think even more so it reminds us of where that aloha spirit falls into this and how we need to care for one another. So it's critical. And so I think, those instances of where social isolation or social distancing is doing good for us from a health perspective, there's also this unintended consequences of how it's impacting perhaps our keiki who are vulnerable, as well as
Hmm.
domestic violence too. I mean, survivor or victims of domestic violence, they're not able to leave a place where they are, feeling maybe vulnerable because,
Right.
they can't pick up the phone or they can't leave and they can't go to places. So I think we just got to be, have our eyes and ears open, and and when we think we see that need, we need to say something. It can't be swept under the rug and none of our business anymore.
Aside from calling 911, are there other um, contacts that you would want someone to report that to, or?
Yeah, there's a for the child welfare piece, Department of Human Services. If you go to their website,
Okay.
the State Department of Human Services has a hotline that you can call, and they actually can help navigate because they'll walk you through it. And you might just have heard like, and not just, but you might have heard some argument that might not have amounted to anything. But put it in their hands and let them go, see, figure that out.
Hmm.
Domestic violence, there's also there's a domestic violence hotline that you can also go to the Department of Human Services website, and they'll navigate you to various services that are out there for the community to lean upon.
Okay.
Yeah.
Great. I've heard throughout our conversation your notifications ring about every 5 seconds. So I know you're extremely busy and that everybody needs you. So I really appreciate you taking this time to talk with us. I think it's so important, the things that you brought up, and especially of how we as a community can be aware and care for each other. So I just want to thank you so much for taking this time to hang out with us. And you're every time I talk to you, I just feel like I'm a better person just being able to hear the things you say. I love your perspective on life. I love the energy that you put into caring for others, and it shows with how you've been able to lead PACT and the team you have there, the ones that I've gotten to know and meet, just such amazing people. So I'm just thrilled that we finally get this opportunity to bring some awareness to parents and children together, and hopefully get more people on board with helping you guys succeed in what you're doing for our families and our community.
Well, thank you. Thanks a lot, Nolan. Thank you for connecting all of us during this time when we're asked to sort of stay away. And I continue to be humbled by the resilience of the people here. I know people are still struggling very much, but there's so many good stories going on of other agencies, of other individuals, and that sort of helps inspire us to continue to do our work and be better at what we do. We certainly know there's many things that we can improve on, but hearing the stories and hearing what folks are doing and how they're overcoming and how people are helping are all things that drive us to do more of the same. So thanks for connecting us to all that.
I love it, man. Thank you so much, Ryan. Really appreciate it. Try to get some rest while you can.
And you too. You take care.
Okay, I'll talk to you later.
Bye bye.
Bye.